Hello again. I'm Dr. J.C. Smith, a chiropractor here in Warner Robins, and I'd like to explain to you more about when back surgery is not and when it is necessary. Because right now, approximately 50 to 90% of back surgeries are deemed unnecessary by their own experts. And the biggest problem is what has been deemed widespread misconceptions. For years, and even to this day, if you have a degenerative disc or bulging disc or herniated disc, the doctors immediately, in a knee-jerk fashion, tell you that automatically needs surgery. Well, that's not true. Since 1990, Dr. Scott Bowden up at Emory Spine Center in Atlanta, he did the first study on people with and without back pain, and he found bad discs in both groups of people. And his study has been duplicated 33 times around the world, so much that in 2014, the Mayo Clinic did a systematic review of all these studies, and they found that there are asymptomatic patients who are riddled with degenerative disc, bulging disc, herniated disc. I mean, it's shocking. By the time you're 50, there's an 80% chance you'll have a degenerative disc, but you have no pain. Most back pain is due to joint dysfunction. When these joints in the spine get jammed or wrenched or twisted one way or the other, then it causes an overloading on the disc. And you can see the red bulge here. But a disc is not a muscle. It's just a shock absorber. It doesn't move. It just glues one bone to the other. But when you mechanically overload it through misalignment and compression, then it will bulge, just like a sprained ankle will bulge. It doesn't mean you go in there and fuse the ankle, or worse, in many of these cases with stenosis, they want to go back and take off the back half of your vertebra. I've had 2 cases where they took the entire neck. They did laminectomies, which is nuts because, again, you adjust these people. There was a big study done by the North America Spine Society, and they found that 75% of patients with stenosis in their low back got better through exactly what we do here, the decompression tables and deep tissue massage. Yet when they were feeling better, they still had stenosis. They still had the bad disc. Again, most back pain is a mechanical problem with your spine first and foremost. Now again, there's always the 10% of what we call red flags. They have cancer, fractures, infections, or the ones that just don't respond to what we do. And there's also, for those of you who've been to other chiropractors, for your information, there's 140 different chiropractic adjustment methods out there now. So, like Forrest Gump once might have said, going to a chiropractor is like a box of chocolates. You never know what you're going to get. So I say, if you've been to chiropractors, I don't care what technique they've used. Most get good results, but for those of you who haven't, you may need another type of adjustment because, again, they're not all the same. And so that's why we usually see if people who've been elsewhere, they didn't get good results with the general methods that other chiropractors use, including the non-force methods or the little instruments that are so popular now. And those are good in certain cases. But for those that have the good old low back problems, they're not going to rehabilitate a disc. They're not going to decompress you. They will move the joint, which is enough to help you feel better. But when you have a serious low back problem, as these show, this is phase 1, where you have bulging disc, you have tears in the disc itself, but basically it's a healthy spine. It's just in the state, it's like a swollen ankle. If that goes uncorrected and pain will subside, then it's going to start causing degeneration. You can see here the degenerating disc, the disc protrusions of bone spurs. Yet if you were to go to an MD or surgeon with this, he'd immediately say, oh, you need fusion. But all the fusion does is take you to the next phase. Instead of a natural fusion, it's an artificial fusion. The best treatment for this is, again, to decompress the spine, restore joint motion. That's what adjustments do. And also the DRX, this decompression table we have, it actually pulls as high as 150 pounds per square inch on these disc spaces. And what that does is it decompresses the disc and allows nutrients back into the disc. This is one thing, most people are terribly dehydrated. You're supposed to drink about at least 50 or more ounces of water a day. And that's assuming you're not outside exercising or it's hot. And also there's things you drink that will dehydrate you, such as coffee, cokes, and alcohol. But if you're dehydrated, you can could hypothetically have the prettiest, straightest, strongest spine in the world. But if you're dehydrated, these discs will dehydrate because they're 80% water. But if you don't drink, they're going to dehydrate. So there's a lot to rehabilitating the spine, but it starts with, one, adjusting the joints. That's what classic chiropractic adjustments do. And also decompressing these discs to let the nutrients be reabsorbed, and also to take the overloading off of the disc and the joint unit, which includes back here. So there's a lot to rehabilitating a spine. It's not just what I call a pop and a prayer. I want you to think more about a football player who's torn up a knee. You don't just put the knee on alignment, then you go into rehab, intensive rehab. And for those of us, including myself, that had a football knee, you know these never completely go away. If you don't manage it for the rest of your life, you will have relapse, more degeneration, and such. But you can manage a bad back by following the different principles that we teach here. First of all, restore joint motion by realigning the joints as best possible. That's what good old adjustments do. Decompress the spine with the DRX tables, also these inversion tables that are so popular now. They do it to a very slight degree. It's better than nothing, but it doesn't compare to the 150 pounds of pull the DRX does. Also strengthening the core. Again, it's like a football player. If you don't strengthen your knee, the knee's not going to stabilize. So, and then flexibility. Joints are supposed to move, right? That's the whole idea of a joint as opposed to being a straight bone. But most people don't realize the spine has joints. Actually, it's astounding. You know, most people know there's 24 vertebrae in the spine, but they don't realize that there's 137 major synovial joints among those vertebrae and the pelvis at the bottom. But when you start counting up all the rib heads and all the small joints of the spine, actually it approaches over 360 joints. Again, all people have been taught these widespread misconceptions is that you have a pulled muscle, so take drugs, or you've got a slipped disc, so you have surgery. Well, first of all, discs don't slip. They may bulge, but they don't slip. Again, they're adhering to the bones themselves, the vertebrae. So there's a lot of misconceptions, and that have led, first of all, led to the opioid crisis. Again, that was brought to you not by chiropractors, but by the medical world, giving people with chronic pain who should have been referred to our offices because we're the leaders in neuromusculoskeletal disorders, according to all the experts. But MDs don't follow guidelines. They follow the money. And there's a lot of money. Most people don't realize it, but spine care is about a $600 billion a year industry. I mean, for example, one back surgery, according to the Mayo Clinic, just one level is a $77,000 surgery. And because most back pain is not due to the disc, people don't get better. They have a 50% failure rate. So what do the doctors tell people? I've heard this a million times. Your surgery didn't take, let's do another. It's amazing. They just keep feeding this BS to people, and people don't know. They're naive and gullible. Well, whatever you say, doc. And the worst thing these unethical surgeons do, and there's plenty of them, is they frighten people about chiropractic care. They say, well, if you're stupid enough to go to a chiropractor, don't come crawling back to me and you're paralyzed. Wait a second. My attitude is who's herniating who? There's been research on this. For example, the malpractice insurance companies, they know who's herniating who because they pay the malpractice claims, right? Well, a neurosurgeon told me his malpractice insurance was $200,000 a year because one oops moment is a $300 settlement, $300,000 settlement. My neighbor just retired. He was an OBGYN here in town for 40 years. But the straw that broke his back was when his malpractice got to $60,000 a year, which is $5,000 a month. You know what I paid last year? $1,500. So my point is, who's herniating who? We're not herniating people. We work with the body. We're not drugging it. We're not cutting it. We're not shooting it up with steroids. We work with the body. And that's why we get such great results and we have the lowest malpractice rates. But again, the medical world has put out all this BS about how dangerous we are. For example, the Gallup, along with Palmer Chiropractic College, did a survey on who's herniating who, and they found that chiropractors did have accidents, 1 in 5.85 million cases. That's a lot of people. Considering we see about 35 million people a year, that's about 6 people for the whole year, for the whole profession. On the other hand, the medical world, they calculated the number of people are dead or seriously injured from back surgeries, drugs, and epidurals, and it came out to 2,500 people per 1 million. So again, who's herniating who? So if you have a doctor, whether it's a surgeon or your favorite family doctor, your primary care, and you ask them, should I go see a chiropractor, which is what the guidelines now say to do first, and if they lie to you and try to scare you, it's what I call the voodoo diagnosis, where they scare you into the surgery or into taking their drugs and they scare you away from chiropractic, you can't trust that doctor. And if you can't trust your doctor about back problems, what else can you not trust them about? Are they railroading you into heart surgeries, stents, knee replacements, shoulder replacements? There's a lot of voodoo going on in the medical world, which is maybe one reason why medical errors is the third leading cause of death in the United States now. Third leading cause of death. The British Medical Journal determined that in a study 2 years ago. They also did another study that the public needs to be aware of. The British Medical Journal editors did a study on the 3,000 most commonly used medical treatments. And they found, first of all, 50% of them were totally ineffective. That's 1,500 types of problems are totally ineffective treatments. Then they also found 10% were unproven, and another 6% were too deadly to use. That totals up to 2/3 of the 3,000 most common medical treatments are no good for nothing. But they're not warning you about that, are they? Well, look what they also led to. Not only the opioid crisis, that was brought to you by your favorite doctor in pain management clinics, they also led to this super germ crisis we now have. They were handing out antibiotics like candy to people. And what did it lead to? Super germs that now no antibiotic can touch. The experts are saying that by the year 2050, super bugs will be the #1 cause of death in the world. Again, who's hurting who? That's why I say take your doctor's advice about back problems with a grain of salt. They don't study it. Research has shown they have less than 10 hours of education on the spine. We have 4,000 hours, which half of that is specifically on the spine. So I tease patients who go to their MDs for so-called advice, and again, they're going to say pain pills, muscle relaxers, shots and surgery, and don't go to a chiropractor. That's what their knee-jerk response is. I said, you could have gone to a dentist and got the same bad advice. They don't study the spine, but at least the dentist would be saying, look, that's not my expertise. Go see a chiropractor. But doctors don't. They hoard all these patients for themselves. And again, what has it led to? A tsunami of ineffective back surgeries, this epidemic of opioids. It's amazing. What was it? 40,000 people last year died just from opioid use, and 70,000 died from all pharmaceutical side effects. We're talking about dangerous treatments here, when most of these can be solved naturally by what we do here. Adjustments, deep tissue massage, self-care home exercises, principally flexibility. That's how you're going to solve your problem, not by taking more drugs or having more surgery. Now, I know this is pretty hard to understand for people who have never studied the spine and know the controversies that exist. So I have written a few books, and for those of you who are most interested, this is one of my first books. I had a lot of fun writing this one. It brought all this information together. Since then, I've written a few more. But for those who come in for a consultation, feel free. I'll give you one of these for free. This will get you up the learning curve. So along with my world-famous chiropractic CD, which speaks about the principles of chiropractic care, you will know more about spinal care than any of your medical doctors combined. I guarantee it. Because you're going to there's a paradigm shift going on. We're getting away from drug shots and surgeries, and they're getting into chiropractic care, acupuncture, massage therapy, natural, conservative ways of managing your back pain. And not just back pain, but other joint problems as well. So there's a lot for you to learn, but you need to learn this. Otherwise, you're going to be a victim of unnecessary surgeries, victim of all these drugs that are going out now, and none of them work unless you have cancer, fractures, infections. But even then, it's risky business. So come on in, we'll talk more about your specific case.